think that's a positive thing to talk about stuttering, not fluency, because just using that term of fluency, it really does drive the therapeutic message towards increasing fluency, increasing smoothness of speech. And again, it returns us to that sort of centering of not stuttering good, stuttering bad. And I think that's a flawed paradigm.
Welcome to Some Stutter Law, a podcast by the Communication Collaborative. Some Stutter Law is Newfoundland and Labrador's first podcast about living with communication differences and disorders. We speak directly to people living with speech and language disorders and others such as speech-language pathologists, researchers, educators, family members, and allies. We use inclusive language and themes to help rebuild confidence and hope by dismantling myths, stigma, stereotypes, and barriers. My name is Greg O'Grady, and I am a person who stutters and the host of Some Stutter Law. Some Stutter Law mission is dismantling and rebuilding communication disorders. Let's start listening. Some Stutter Law mandate is, in the spirit of Newfoundland and Labrador's humor, robust and frank interactive discussions, Some Stutter Law podcast aims to rebuild confidence and hope for people who live with communication differences and disorders by dismantling myths, stigma, stereotypes, and barriers. Some Stutter Law podcast objectives are raising awareness, education, understanding, and acceptance of communication differences and disorders by providing support, current information, research, and resources. Raising awareness that communication differences and disorders can impact a person's life emotionally, educationally, physically, socially, and vocationally. Creating a safe space where guests can be themselves without fear of being judged. Today, Some Stutter Law welcomes guests Janet Tilstra. Have I pronounced your surname right, Jan?
It's Tilstra, a lot of consonants. Okay. LS.
Tilstra.
Yes.
Okay. Today we welcome Janet Tilstra.
Yes.
Janet is a speech-language pathologist and an associate professor in the Department of Communication Disorders at St. Cloud State University, St. Cloud, Minnesota, USA. She completed her undergraduate and master's degree in speech-language pathology at the University of Iowa and her doctorate in educational psychology at the University of Minnesota. Dr. Tilstra teaches undergraduate and graduate courses on stuttering, language development, disorders, and research methods. She is an active clinical supervisor and passionate ally dedicated to amplifying the voices of people living with communication differences and disorders. She enjoys mentoring students, consulting with nonprofit agencies, and designing innovative training modules. On a personal level, Dr. Tilstra lives along a slow stretch of the Mississippi River. She loves kayaking, nuanced conversations, books with great character development, all things music, and winning board games. She strives to think like a scientist, foster potential in others, live a balanced life, and make the world a little bit better. So thank you very much, Jan, for joining us this morning. So we are very honored to have you part of our podcast today.
Thank you so much for the invitation, Greg. I'm just delighted to be here and have a conversation with you.
Okay. So I'm wondering now, Janet, would you be able to share a little bit about your history in terms of how did you get into the world of embracing stuttering and communication disorders?
Sure. Um, that goes back a lot of years. When I was a student at the University of Iowa, at that point in time, there was a summer residential program where school-age children who either stuttered or had a dyslexia or significant learning disability or cochlear implants would come to the campus for a 6-week block of time, and they would have personal goals they were working on related to their education or their speech or their language development. So as an undergraduate student, I gosh, how old was I? Probably 20 years old. For 2 summers, I was part of the live-in staff in the dorm. So I was sort of the camp counselor, if you will, for a small group of children for that 6-week block of time. And so both years I was assigned with young, I guess I'd say school-age boys, a group of 3 school-age boys who stuttered. And so I was just really immersed into the world of thinking about how to be, I guess, almost a coach, a teacher, someone seeing the day-to-day experiences of school-age kids who stutter. That was just a really powerful supplement to my more academic coursework that I was having at the University of Iowa. And as you know, there's a long history of stuttering research, stuttering methods, some of it positive, some of it not so positive. So again, just that foundational experience working at that summer residential program and the coursework that was happening simultaneously, I think really grounded me in thinking about and learning about stuttering.
Hmm. When I was doing some you know research recently, Janet, I came across your your article in Astra Leader Live, and this is your article in the American Speech Language Hearing Association, and so the name of the article is "From Speech Helper to Ally." A clinician changes her own perspectives of speech fluency and encourages others to re-examine theirs. I found this article very refreshing. I actually, appreciated this, and because I mean, it's unusual to hear a to hear a speech language pathologist like shifting paradigms, moving, moving away, not necessarily away from from a clinical perspective, but also in embracing the importance of being an ally for people who stutter. And I liked how you open up the article. It says that for years, I've worked clinically with people who stutter and their families. I mainly focus on building clients' capacity, building knowledge, teach speech techniques, boost confidence, rinse, repeat, add a dash of behavior, change from some significant people in the person who stutters world. Voila, job is done. Would you like to elaborate on this for us?
Sure. Yeah. Um, when I was thinking about the the article and the message, and just thinking about my own journey, um, I wanted to start with thinking about myself as really a well-intended person, a well-intended clinician. I think I'm well trained. I've had um, lots of experience that is thinking beyond just speech, but I started to realize I was still drawing my circles around the individual making changes and not thinking so much beyond the individual and the people who immediately touch upon them. And I think two things have started to shift for me. One is really thinking about, I guess I'd say, the water we swim in, and I mean societal water, and the way that people with communication differences are perceived, and stuttering as one exemplar of that. And on some level, I mean, I've known that for years, but I don't think I thought I had much responsibility or agency in the domains outside of the therapy room. It was like, this is what I do. These are the boundaries of my professional work. And that's where I'm starting to shift is really, is that the limit of what I can talk about, think about, do, and influence? And I would say no. I think there are places where I can stretch and influence a little bit more. So that's where I'm at.
Hmm. Uh, when when you talk about changing paradigms, you also mentioned in your article, while many speech language pathologists are teaching speech strategies to people who stutter, many researchers, authors, SLPs, and public speakers are questioning the value placed on perfect speech fluency. Is success for a person who stutters overcoming stuttering or living with stuttering? And so, as a person who stutters, I mean, this is part of my challenge as well because it's very difficult for me still at this senior age to to you know to accept Greg O'Grady as a person who stutters. And as with a history of being a covert stutterer, it's always a challenge to even hear myself. And even when I sort of preview these podcasts as well, I still have difficulty, uh, difficulty uh, uh, hearing myself stutter. So, Janet, would you talk about uh, like when you talk about perfect speech fluency, what what does that mean in living with stuttering? Like,
Right. I think that in speech pathology, the origins of our discipline are from psychology, from medicine, from linguistics. And we have this deep, deep grounding in the medical model of treatment, which is what are the symptoms? Let's identify what's wrong. Let's treat that. We'll fix it. It'll get better. The person's life will be better. And I think that all of healthcare has had a shift to more person centered care. And so thinking about not just what are the symptoms, but what are the person's values? What are the person's priorities? What's going to help with those larger life outcomes, whether it's communication, whether it's the way that Greg looks at himself as a person, an intellectual, a communicator in this world. And I think it calls to question whether just treating the overt behavioral symptom that I see is going to help Greg or whoever my patient is get to that place of a better life outcome. And I think there's lots and lots of rich social science research that's happening related to shame, related to what's the cost for people who stutter to try to kind of like cover that and pass as fluent or keep from stuttering. And there's just evidence that there's really tremendous psychological consequences of that hiding stuttering. And so I think those of us who are in the therapeutic fields where we're doing therapy with people who stutter, I think we have some hard questions about what's our historic emphasis as a field, maybe not exclusively on fluency as the outcome, but fluency on a pretty centered outcome. So even if you have an approach where you're talking about approach avoidance, you're having people do voluntary stuttering, you're trying to do some desensitization, fluency is still historically a big part of what most speech pathologists have done. And I think the research, people's experiences, the stories of adults who stutter are really helping us to just question some of those assumptions and think about what are the new paradigms. How do we progress forward, allowing the person who stutters to be part of the decision-making process of what pieces of intervention are most important to them, and that knowing that may shift at certain points in time too.
Mm-hmm. Mm-hmm. Yeah, you just mentioned as well, Janet, that the recent research indicates the greatest predictor of psychological distress in adults who stutter is the degree to which they conceal their stuttering. Not the severity of their stutter, but trying to pass as a fluent. And I, I, I support this because, as I mentioned earlier, that with the history of being a covert stutterer, that when one is so caught up with trying to sort of pass as a fluent speaker, that one loses a sense of identity. It really impacts one's quality of life. And so how would you sort of work with a person who came to your office and said, Janet, I am a covert stutterer. How can I live more authentically and learn to accept my stutter? I mean, this is a lot for an SLP to deal with, especially when someone first comes to the office.
Right, right. There's some really good training in the areas of solution-focused brief therapy, also motivational interviewing, which I think are great resources for speech and language pathologists to pursue. And I think that can help you in terms of starting to think about how to have those conversations, because they are complicated and difficult, and you don't want to minimize or simplify the challenge of a person making a choice to stutter freely when they've been a covert stutterer for years. So I think the first thing that I do is if you came in and you had been hiding your stuttering for years, I probably would talk about, tell me what brought you in today. And I would want to hear what's going on with you. What are your experiences? As we're talking, I'm curious about your story, if you're willing to talk about it, Greg. But so for you, at the point when you were coming in to seek treatment, why was that? What was there a turning point, or when did you decide to come in?
It was for me, Janet. It was sort of I had started a new job, and this job actually required a lot of communication. And I had learned in the past that by depending on old tricks like word substitution, it often got myself in the trouble. And because often when covert stutterers, as well as I feel that overt stutterers as well, always have some tendency to for word substitution, avoiding social situations, introducing themselves. And so, so I thought to myself that so this is where I was being challenged, because if I wanted to progress in this position, I needed to be more open and more honest about my stuttering, because it also sort of it also sort of can really, if I'm word substituting, I can easily lose the message. So I felt that I needed to really sort of focus on my stuttering, because Janet, my history is that I used to have a very severe stutter, because I remember the worst scenario was that an example was when when I left Newfoundland and live with with a number of people. I used to be had this phobia about being asked my name, and
Mm.
so also my worst memory was that I actually used to have a second characteristics of stuttering, like, what is your name? My name. So I used to lift my arm like this and say, look now, look now, look now. I would look at the ceiling, and I remember there's a group of people around me, all strangers. So I would say, look now, look now, look now. My name is Greg O'Grady. So, I mean, so really that's how severe my stuttering was. I mean, we all, we cannot, there's different types of stuttering. So I managed to get through that. But so I actually went for speech therapy, and back then I was focused on the clinical component, meaning that I really wanted to get some tools and targets to help me be more fluent. A lot of emphasis was on the fluent. And so really, this is where I was sort of focusing on. And it's hard for and it's hard for anyone in speech therapy to try to implement targets. You know what I mean? Especially when you're nervous, when you're upset, anxious. That adds a lot of frustration as well, because you actually feel like you're a failure, and that reinforces the feelings of embarrassment, lack of confidence. So that's my history. I was focusing on the clinical component, but I feel now, as I'm older, more wiser, we hope, that is so important. I stress this a lot, because sometimes I feel the emotional, well, I shouldn't say sometimes, I feel that the emotional component of stuttering is so not really addressed as much as it should be. And this is one of the reasons why we have this, our Some Stutter Law podcast, because it is a platform for building awareness and acceptance, but also to talk more about the emotional component. And so when I read your article, because it actually talked a lot about uh, you know um, self self acceptance, and I think this is where we were depending, and this is where the paradigm shift you're talking about, moving from like the clinical focus, not only and the clinical focus, but also being an ally, because you really support the SLP in embracing the whole person, not coming from a clinical point of view. I'm not too sure if I answered your question.
No, I
With me
mean, I
rambling
think
on.
there's some commonalities with your experience and what I've observed with clients or patients. We use different terms, but often people will come seeking support, therapy, when there's some kind of a shift in their life, a new job, maybe you have a new partner, maybe you're a young adult and you're transitioning from your family of origin to sort of your own life and thinking about, what do I want to be about? So I think that's a very common scenario, and I it's a really important time to think about those bigger questions. So speech tools can be a piece of what the speech pathologist is addressing. Um, but I think understanding what is the life impact of living as a person who stutters, what behaviors are you changing that maybe you don't want to change, but you feel you're not participating in your life in the way that you want to because of whether it's shame or how you're perceiving yourself as a person who stutters. I think there are some excellent sort of simplified paradigms that I pointed out a few of those to SLPs in the article that I wrote, and they've been very helpful for me. So thinking, I mean, the first few that rise to the top are the 3 E's by Luck and Gore, and they're looking at just categorizing types of intervention strategies as related to ease, which could be ease of communication, speaking, education, helping a person understand their own stutter and educating important people around them, and then empowerment, really doing things. There can be a whole list under that, but for example, just like you did, you disclose right away, I'm a person who stutters. It changes maybe the pressure for you, and also is really empowering other people to understand you're a person who stutters, and kind of understand the expectations that are going to help you personally. Similar to that is a structure by Transcending Stuttering, which is categorized in 4 areas, which is self-knowledge. So again, knowing about stuttering, knowing about your own experience, self-awareness. So really being aware of not just your stuttering, but also what kind of thoughts, what kind of feelings, what kind of changes might you be making because of being a person who stutters. And then in the Transcending Stuttering, also self-adjustment and self-advocacy are a piece of it. So in the self-adjustment category, that might be changing behaviors, not avoiding words. It might be not avoiding situations. It might be using some kind of a speech technique that you find helpful. And so it's just really broadening out the possibilities of what kinds of things that a therapist can be a guide for helping the individual who stutters as they're making choices about what are their priorities, what's important to you right now as a person who's coming in seeking help. And so it's really flipping. It's not saying the SLP is not an expert, but it's not saying, so it's not like the SLP is the almighty expert, right? It's like the SLP brings expertise. The person who's seeking therapy brings expertise of themselves and their life. And it's combining those two and really co-designing the priorities of treatment. And so I'm really, that's that sort of centering the person and their priorities and their choices is really an important piece of where I would want to get. I think your initial question was in that first session. So we'd want to be starting to really bring both my expertise, your experience, your priorities.
Mm-hmm, mm-hmm. You mentioned that part of the part of the clinical component for speech therapy would be to work with the person who stutters to stutter with ease. This is an interesting. Would you be able to elaborate on that a little bit? Stuttering with
Sure,
ease.
sure. I mean, historically, there's kind of 2 big buckets of the kind of speech tools or speech approaches we have, and they're not really as clean these days as maybe historically. But there was the fluency shaping category, which is let's change the arc of your entire speech pattern so that we're doing things in speaking that are counter to stuttering. So when you see prolonged speech like this or easy onset, those tend to be in the camp of fluency shaping. And then we have another bucket, which historically was stuttering modification. And so that approach is saying, let's not change the entire arc of your speech, but let's look at those moments of stuttering. And often people who stutter in an intention to get through stuttering or to keep moving forward with their speech can infuse some tension or tricks to avoid words or sounds that they know are difficult. And so sometimes that whole what am I doing to try not to stutter can become part of the stuttering and can make it messy and complicated. And sometimes some of those side things can become bigger than if the person just freely stuttered. So the stuttering modification approach, again, historically, is really to stutter with less tension, to stutter with like freely approaching the word, using less tension. If you stutter, using a cancellation, like restating the word with less tension. So that's the historic contrast.
Mm-hmm. Would this fall in line now with a volunteer stuttering approach? Somebody that stutters on purpose, like my name is Greg O'Grady. So is that a form of like working towards self acceptance?
Yeah, voluntary stuttering can be a really powerful method for a lot of things. One is self acceptance. It can be empowering as well. Also, it can be a way for a person to have control of how they are going to stutter, because I'm doing it in this case voluntarily. So I'm going to say, "Hi, my name is Janet," and I'm repeating that first syllable. But I'm doing it in a voluntary way. And so I'm taking control of what's the level of tension in that moment, when there are lots of other moments when stuttering may feel like it happens or I lose control. So it's building the experience of stuttering differently. It also, some people who stutter will use that as a way to disclose that they stutter. Some people will say overtly, "Hi, I'm Janet, I stutter." Others will say, "Hi, I'm Janet Tilstra," and do a voluntary stutter as an indicator to the listener that I'm a person who stutters. So it
Mm-hmm.
can serve multiple purposes, is the short answer.
Mm-hmm. If yeah, if a person who stutters have taken speech therapy, so sometimes I wonder, based on the lived experiences I've been listening to from various people that stutter, sometimes the speech therapy, if it doesn't have the what's the word I'm looking for, if the speech therapy is focuses on strictly on the clinical component of therapy, it 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 can also be a double-edged sword, because one can use the clinical component as a way of masking their stuttering without you know without really addressing the emotional component.
Mm. Yeah,
What are your thoughts about that?
if the measure of success is, am I um, maintaining speech fluency, that kind of shuts out some other possible measures of success.
Mhm.
Yeah. Yeah, I was thinking
Definitely.
about, I think I said this in the article that I wrote. As speech and language pathologists, we are taught to reinforce the behaviors you want to see. So, wow, good job. You really nailed your R sound. Your tongue was in exactly the right spot. It gets a little more complicated for stuttering, because if we're saying, "Wow, that was really smooth," or "You hardly stuttered at all," I think there's this layered message of stuttering is bad, fluency is good. And that's that's really laden with a lot of, I guess, ableism and shame, and just it's a message that's really being questioned by people who stutter, by researchers who have studied the impact of hiding your stuttering. And so I really think that that's a part of the message. When I was writing the article, I was thinking about, just generalist SLP who is really doing good work, really has excellent intentions, and might have some paradigms that it's time to just take a pause and think about, oh,
Mm-hmm.
what is the message I'm sending to this child? Is it being fluent is the best thing? If that's not the message I want to send, how do I unpack that? How do I look at
Mm-hmm.
change that I can measure, change that I can reinforce, but not limiting it to fluency, or you used your technique, so you were more fluent.
Mm-hmm. And you you also mentioned, you also mentioned in your article that, you know, based on this messaging, a speech language pathologist has to be very careful not to portray or 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 insinuating that a stutter needs to be fixed. You know what I mean? That stuttering, as you were saying earlier, stuttering is bad, fluency is good. So I think this is another a fine tuned area that speech language pathologist has to be careful of. That you know people who stutter do not need to be fixed, whereas we as people who stutter sometimes feel that we need to be fixed. What are your thoughts, Jen?
Yeah, I think fluency is a fickle goal and a fickle thing. What I hear from people who stutter, whether it's someone I know personally or whether it's what I've read, is that this good days, bad days paradigm happens for a lifetime. So if I say, Greg, when you're having a good, fluent day, you're a successful human being.
Mm-hmm.
That there's just a lot in there, right? But if I say, wow, Greg, you are living as a person who stutters, and you you introduced yourself without doing the point to the ceiling thing that you used to do. You disclosed that you were a person who stutters. You're hosting a podcast, for heaven's sakes, right? Look at how courageous that is in terms of not letting stuttering keep you from doing these things that are such an important and powerful part of what you bring to the world. So I think if we can look more at those behaviors as, you know, what you're not avoiding or chances that you're taking in terms of positive communication, self empowerment, those seem like less fickle things to reinforce, and frankly more important things to reinforce.
Mm-hmm. Mm-hmm. True, definitely. To actually look at fluency, I mean the F word, I call it the F word as well, fluency. That so it's almost like a reframing, like, and this is something that people who stutter and others with communication challenges, that we have to really sort of reevaluate or reframe what we mean by fluency. So, so,
Yeah.
so so-
Sorry, what were you going to say?
oh no, no, I was going to ask your thoughts on that. Is fluency a bad word? Should we even be using it?
Yeah, there's been a recent paper that came out, and it was I think it was Yaros and Constantino that wrote in one of the ASHA journals um, about fluency and the history of the word, um, and use of fluency and they really are. Sorry, it's Titchener, Constantino, and Yaros. I want to give full credit to everyone involved. So I think that is such an important conversation, and in terms of, I'm very comfortable talking about stuttering versus fluency disorder. The pause I have is there are other categories of fluency disorders, like cluttering or fluency disruptions because of a neurological condition. And so I haven't quite wrestled with what do we do with those things that aren't stuttering, but they're related to disruptions in the flow of speech. So let's just put that in a box to the side. I want to just acknowledge the complexity of that. But in terms of stuttering versus fluency disorders, um, I'm fully in support of courses being renamed to be about stuttering versus fluency disorders, or even I know Kristen Camilla has shifted some of the language she uses. She's a speech pathologist who's very prominent in the U.S., and she's shifted the way she describes herself away from using the word fluency. And so I think that's a positive thing to talk about stuttering, not fluency, because just using that term of fluency, it really does drive the therapeutic message towards increasing fluency, increasing smoothness of speech. And again, it returns us to that sort of centering of not stuttering good, stuttering bad. And I think that's a flawed paradigm.
When what feedback have you received from your colleagues since publishing this this column? What's the feedback been like?
Generally quite positive. I have a couple of close colleagues who are very involved with autism, and there's some parallel changes going on in terms of thinking about neurodiversity as a difference versus a disorder. And so I think some of that, again, we've had some interesting conversations, just learning from each other's areas of focus. I did have a couple of colleagues who don't do stuttering remark, "Oh, I haven't. I can see that some things have changed from when I did my training and when I learned about stuttering initially." So I think just starting to kind of acknowledge that, wow, we are on this kind of journey as a field and as a society, and how we think about perfect speech. And people with communication differences, again, including stuttering.
Mm-hmm, mm-hmm. Jen, I'm wondering as well now, like stuttering, there's grief associated with stuttering. Because stuttering, I mean, there's a definite loss. I mean, based on my experience as well, because we are not we are not what they call a normal uh, fluent speaker sort of thing. And so I think there's a loss there and this loss has to be acknowledged. It's almost like going through the stages of grief. Like I am not going to be a normal person. So that's moving towards self-acceptance and being authentic. Your thoughts?
Yeah, I think that's so important, Greg, and it's challenging because there's this tension between, I call it both and, right? There's this incredible loss and this incredible, um, often frustration of living with a stutter. And there's incredible potential if a person can start to own their voice. And it's tricky. I find this, I return to this with a lot of differences, whether it's disability, whether it's race, whether it's communication. You don't want to minimize the experience of the person. I can't fully understand the experience of what it is like to live as a person who stutters. I'm not a person who stutters. And so I can understand that from an empathetic lens. I'm not living that 100%. And I would be mistaken to claim that I fully understand that. So I think there is some acknowledgement of just there's grief and there's loss. And there's this kind of walking with that. One really powerful experience I had was I was going to just a training session on dialectical behavioral therapy, and I feeling badly that I can't think of the names of the presenters, so I apologize for that. But these individuals, one was a person who stutters, one was a psychotherapist, and I'm interested in the topic. I'm sitting there. I'm a specialist in stuttering. The person who stuttered started out, and I don't know if intentionally or not, but just really severe stuttering. And the first thoughts that ran through my mind, and I'm incredibly embarrassed to even say it, I was like, "Ugh, this is going to be a long training." Right? And I feel
Yeah.
horrible and embarrassed. And yet I tell that story to my students because I think that there's a piece of that that acknowledges the it's a difficult communication interaction, right? But the second part of that story was this person had really identified themselves as, here's me, here are things about me. Stuttering is one of those things. And this person had embraced, I'm sure through many years of work, had embraced this idea of acceptance and commitment therapy, which is I don't have to like that I stutter, but I don't need to let it define me either, right? So it's a thing I'm walking with. It's maybe right beside me, maybe it's on my shoulder, maybe it's in the back seat of the car. I don't need to let it drive. And I think that's a really healthy place to get to. And throughout that training, when I started to realize how much that individual had owned their stuttering and just how they had conceptualized it, I really started to understand the topic, which was the acceptance and commitment therapy. But also it was just one example that I think was a really powerful illustration for me.
Mm-hmm, mm-hmm. Listening to you talk about the acceptance and commitment therapy is called ACT by Russ Harris. Am I correct? Russ
Yes.
Harris.
Yes.
So so a speech language pathologist about the the analogy to my attention. And I and I think it's this is by Russ Harris as well. She she talked about the beach ball analogy. Like when a person who stutters is trying to hide the stuttering is almost similar to trying to push a beach ball in the water all the time.
Mm,
And just just thinking of how much time and energy that takes just to push this beach ball in the water. And I thought that, this was an appropriate analogy for people who are covert and or overt stutterers. Your
yeah.
thoughts, Janet, on that?
That's a new analogy for me, but I really like that a lot. Yeah, you can just really see the effort that it would take to hide versus if you're just pushing the beach ball along on the surface.
Mm-hmm.
Yeah, thank you for that.
Oh, you're welcome. It isn't me, but she, she quoted quoted Russ Harris. So I think he he has to take credit here. I think I'm not too sure. You know, there's there's a history of speech language pathologists that no, based on what I've been hearing, talking to other SLPs that like students or like there's a number of SLPs that tend to shy away from stuttering because of all the emotional component. Is that do you feel that that paradigm is changing, a shift?
Um, Maybe yes and no. I think um, I'm preparing a workshop with a colleague for our state association, and it's on person-centered therapy. And so in our preparation, I think that there can be a couple of challenges. Some people are really interested in doing more with feelings, thoughts, with those sort of non-speech parts, but aren't sure how to measure that. So that can be one stumbling block. I think there are others who wonder, okay, when am I moving from my profession of speech to doing something else that's outside of my scope of practice? Um, Looking at the definitions of stuttering, most of the modern definitions will say stuttering is, and then they'll define the experience of stuttering, not just the moment of stuttering. And so it's this experience of disruption, loss of control, speech disfluency. So that would suggest, and ASHA supports that. ASHA is our American Speech and Hearing Association. ASHA would support that that doing holistic treatment is appropriate if the thoughts and the feelings and the patterns are related to the communication difference. That's absolutely within the scope of practice. So I think some of it's comfort level. Again, some of it's that stickiness of how do I measure change here. And then some of it's just really feeling confident that I'm maintaining an appropriate scope of practice and not straying from my training.
Mm. As people who stutter, what can we do to support the speech language pathologists? What can we do?
I think things like the podcasts that are out there, like what you're doing right now, just having conversations, whether it's a conversation about stuttering or whether it's just adding voices of people who are not perfectly fluent, just like let's make the sort of range of what's considered acceptable um, broader, right? So it used to be that with newscasters, there wasn't a tolerance of non standardized Midwestern accents. And now there's a huge shift and quite a huge value of that. I think in the area of communication differences or disordered communication, at least historically speaking, um, we're still we still have room to go in terms of being used to hearing voices of people who stutter, being used to that as a piece of normal. So I think keep telling your stories. I think keep, whether that's writing them, whether that's doing podcasts. I've heard some slam poetry that is just super inspiring. There's some beautiful art that kind of illustrates maybe what is the experience of stuttering. And I think all of those things inform speech pathologists in terms of, okay, what might we do on the front end that's going to be leading to successful life outcomes. And second, I think it just really informs society of, you know, here is something that, 1 in 100 people are living with a stutter. And so I think just the visibility, I think, is really important.
Hmm.
And as I'm saying that, I'm pausing a little bit because I think it's not fully the responsibility of people who stutter to change society. So I don't want to send that message. Um, those of us who are in the profession, I think, have a voice that can be trusted as we talk about stuttering, because for better or for worse, we can be presumed to have some expertise. So I think there's some responsibility for those of us in the profession. And then I think just other allies who may not stutter, but can start amplifying the voices of people who are fluent or not fluent.
Mm-hmm.
Yeah. What thoughts do you have on that? What do you think will help speech pathologists or changing the societal climate?
Well, I agree with what you're saying as well, Jenna, because I mean, this podcast is new to Newfoundland, because when I retired and moved to Newfoundland, which which is my home. I retired in 2017, and and I was living in Toronto at the time, and I was very fortunate to to have to have received to to have received speech therapy in Toronto, and so I had a lot of support in Toronto. But when I moved to Newfoundland, I started to investigate, what supports are available in Newfoundland and Labrador for people who stutter. And so I was, I was surprised that there was, there was not, there's very little support or acknowledgement of stuttering. And this is no disrespect to speech language pathologists. We have a number in Newfoundland, not that many, but we need more. And so I thought to myself, let's start bringing stuttering to the lens of Newfoundlanders. And so I started to walk and run here in Newfoundland. It is called A Million Things I Need to Say. A
Mm,
million things I need to say, because people started have a million things they need to say. And so this is in our fourth year, and so we also, with the support of the a passionate group of volunteers, we also started the Newfoundland Labrador Stuttering Association, and we also started the Some Stutter Law podcast. So I think that, so as people study, we need to be more visible,
mhm,
and being more visible, meaning that we need to step out of our comfort zone. And because it's so easy, because I think once we challenge ourselves, we sort of become more fully alive, but we
mm,
also sort of, teach the public. So I think we have responsibility, a large responsibility to teach the public about stuttering, to actually bring the stuttering under the lens of government. In Newfoundland as well, in Labrador, we also need more supports for, supports not only for ourselves but for our families, but also our speech language pathologists, teachers as well, because I feel that because studying is not under the lens of the government, where the people study are losing out as well. And
mm.
and the speech language pathologists, they need additional support for training, teachers. So I think we have responsibility to be more visible, and that's scary. That's scary because we're really, we're actually moving out of our comfort zone, and we also need more SLPs like yourself, Janet, who are allies, who are being vocal about it.
I I love how you kind of didn't see what you thought should be there and really took steps to be a part of creating um, opportunities, messaging, training. I I really admire that.
Mm, thank you, thank you very much. Well, not to hold you up in anymore, Janet, but thanks a lot for your time. But now, do you have any questions for me, or any comments or anything?
Um, well, I was thinking of two final things. One for SLPs, for the SLPs that are listeners, maybe you are new to doing stuttering. Maybe you feel like some of the treatment you've done in the past has been heavily speech focused and you're looking to change. And I would say, I would encourage you to focus on do the next right thing. I don't think it's worth spending a lot of time thinking about the things you wish you had done in the past. So I think if you're moving forward on a paradigm, keep learning. There are lots of communities of people who are thinking about and learning about person-centered approaches. So seek that, keep focusing forward. Um, the second piece that I would say, this is a message for myself and other listeners who are interested in being allies. I think keep thinking about who might benefit from knowing a little more about stuttering. And for me, I think about we have a strong criminal justice training program. And so officers of the law, that's something that's important for them to have on their radar. Communication differences in general, and stuttering is one of those. Um, there are some initiatives. I believe John Gomez has been involved with some colleagues with training interviewing practices at businesses, some of the larger Silicon Valley businesses, and really having people aware of what might be the experience of someone who stutters in that interviewing. So I think that we have all kinds of peripheral people in our world that we as speech and language pathologists or people who know something about stuttering and person-centered approaches can really just look for opportunities to continue to have a voice.
Mm. Uh, for our listening audience, Janet, would you explain differences between communication differences and communication disorders?
I I don't it may just be linguistics. So there's that.
Okay.
Historically, again, this probably harkens back to that medical model. Historically, there's been quote unquote normal communication, and then a communication disorder might be initially resulting from something like a, a stroke or a neurological insult. And so that was one of the origins of my field, was thinking about people who had, again, quote unquote, normal communication. Something happened, their communication changed. And so that led us into some of this normal versus disordered language. It's
Mm.
for people who are born with a communication disorder or difference. I'm becoming less comfortable with the term disorder, and I'm sort of
Mm.
sliding towards communication difference or a condition. So, like living with stuttering, I think it's living with the condition of stuttering. But I still have a bit of that legacy in my language, or I think whether for clarity or whether it's just hanging on, I'll sometimes use difference and disorder interchangeably.
Mm-hmm. Thank you. Thank you. And thank you again, Janet, for writing your article, because I learned a lot, and and as I mentioned, I also found it very you know refreshing to read that the speech language pathologists are shifting paradigms. They're moving towards a more like in embracing the whole person of a person who stutters, not only just the actual physical aspect of stuttering, but the emotional, psychological component. So there's a whole definite positive shift in paradigms.
Well,
So
Greg,
thank you again for writing it.
You're very welcome. And this has been just such a pleasure to have a conversation with you and to hear about your work. I kind of made some side notes to myself of things I want to look up that you're doing or have done in the past. So really just such a pleasure. Thank you.
Okay. Well, we will have you back again to con- continue the conversation, Janet.
I would love that, Greg. Thank you.
Okay. Thank you again for your time and enjoy your sabbatical.
Thanks.
Okay. Take care. Bye.
Some Stutter Law is hosted by Greg O'Grady. It is produced, recorded, and edited by Paul DeDecker, as well as Luca Dini, who, by the way, wrote this jazzy theme music. Leah Bugden and Alicia Megison command our pages on Instagram and TikTok. You can listen to or subscribe to this podcast on Apple Podcasts, Google Podcasts, Anchor, and Spotify. Video versions of each episode are found on our YouTube page. Some Stutter Luck is a production of the Communication Collaborative.